Good morning, everyone. I'm Alexandra Villa-Forte. I'm a doctor here at the Cleveland Clinic. I'm a rheumatologist specialized in the care and treatment of patients with vasculitis. I'm here with Allison Lint, and Allison is one of my patients and who has Wegener's granulomatosis, formerly known as Wegener's granulomatosis, now known as granulomatosis with polyangiitis. We shorten as GPA to make it easier. And I've been treating Allison for a number of years, and she has presented the disease with lung and kidney involvement, and that's the common way this disease usually presents. So Wegener's granulomatosis, or GPA, granulomatosis with polyangiitis, can present very commonly with sinusitis, nose disease, ear symptoms, sometimes hearing loss, lung involvement that can lead to cough, severe shortness of breath, sometimes bleeding to the lungs. Also, inflammation of the kidneys that, if not treated, can lead to kidney insufficiency and even the need for dialysis. So it's a serious disease that we have to be able to diagnose this very soon, early on, so that we can appropriately treat all the patients before any damage occurs and give them a chance to have a normal life with a good quality, and that way the disease is controlled and under remission. It is a disease that tends to relapse, meaning that it comes and goes. It comes as a form of recurrence and causes inflammation, and we are always monitoring the patient so that we can diagnose any recurrence of the disease very early on and treat it as appropriately so that we can put the disease in remission again. So Allison, welcome here today. And thank you for being here with us and doing this, and it's very exciting. And why don't you start telling us about the time when you were first diagnosed and what kind of disease you have?
Sure. I became very sick when I was 16 years old, and I wasn't actually diagnosed until I was 17. And when that happened, they said that I had Wegener's granulomatosis, which is now granulomatosis with polyangiitis, or Wegener's.
So as Allison mentioned, Wegener's granulomatosis is now known as granulomatosis with polyangiitis, so we're going to refer to the disease as GPA, just to make it easier and shorter. And so, Allison, when you were first diagnosed, what kind of symptoms were you having? How sick were you? And
it started with respiratory symptoms. It was all in my chest and my lungs, and they thought that I had bronchitis, and then they thought I had pneumonia, and I was very fatigued, so I didn't have a lot of energy. And when I became very ill, I began to cough up blood, and that was actually the sort of the sign that there was something very serious going on. And then when I was actually diagnosed, they did a few tests and found out that there was blood filling my lungs. So I had a pulmonary hemorrhage. That was the main symptom. And I also later was found to have some kidney involvement as well.
Okay. So, and you started to receive treatment, and how did you do?
Well, no, I started on one medication, and that didn't work very well because then I had a slight relapse, and so they switched me to another medication, which also didn't go incredibly well, so they switched to a third one. And it took several tries to get the one that worked best for my body, and then when they did find that, I did very much better, and just recently was able to say that I was in remission, so I'm now doing just fine.
So it seems like you have struggled with some recurrences of the disease.
Yes.
So every time they had the disease under good control, at some point in time you had like a relapse.
Yes.
The disease would come back and they had to make changes in
There
your
were
treatment.
a couple of relapses before they found what worked best.
So all these relapses, how did they impact your life and your work or your studies? Mm-hmm. How did you deal with all that?
At the time, I was only in high school, and so it was tough. The social aspect of things was hard, trying to explain to my friends what was happening and get them to understand that this was a rare disease that was very difficult to cope with. And being on high levels of steroids, which is sort of the standard treatment for a lot of these vascular illnesses, does really horrible things to your body, and it made me feel really awful, and I lost a lot of my hair, and I had a lot of skin problems, a lot of weight gain. So socially, it was very difficult in high school having to cope with that. Musically, at the time I was studying to be a musician, and that's what I do now full time, and I love what I do, and I'm very thankful that the illness does not directly impact that. At the time, though, I did go for a while without being able to play, and so that was difficult as well, to have to get back into the swing of things and get my fingers back on the instrument and remember how to play.
Well, I have seen you and watch you play, and you do beautifully. You're a wonderful professional. So maybe now that you have been doing better and the disease is under remission, and we do a very close follow-up, so we make sure that it doesn't come back and we don't catch it early enough to treat, so that you can have a normal life and a good quality of life. So can you tell us, what have you done in your life that has been influenced by your disease? So how did you use all this struggling and all this suffering with the relapses and different treatments, and use that in a way that I know, but I want you to explain to everybody?
What I did was I started a program called Violin for Vasculitis, and I decided that I wasn't okay just being sick. I wanted to do something about it, and I wanted to help other patients and give them hope, and also spread awareness is the main thing that the project accomplishes. And so Violin for Vasculitis, what it entails is that I'm on a mission to travel to all 50 states in the country and play a musical concert, and also give information about the disease and how it affected me and where others can find help. And along the way, I've met so many patients that are worse off than me, and it's given me hope knowing that I'm doing so well, but I think it also gives them hope knowing that I was so sick and then I recovered and I'm in the place that I am today. And I have the disease, there's no cure, I'm always going to have it, but I'm doing very well and I feel healthy, and that's the important thing. So.
And what kind of impact do you think your project's going to have in the life of other patients with the same disease?
Well, I've already heard from many of them that said it was so nice to be able to see someone else who was doing all right, because I thought that I was never going to get out of this pit, and I was so depressed and I was so anxious, and seeing what you do gives me hope, and then they in turn go and spread awareness in the way that they do best. And that's what's really encouraging about this, is to show other people that they can be the ones to make other people aware of this disease and comfortable with it, so that it can positively impact other people with the disease.
When you are playing the violin in one of these concerts for increasing awareness about vasculitis, your project that you created, what kind of reaction do you get from the public in general?
Oh, all kinds of different reactions. Some people just really enjoy the music, and they understand that something very dangerous happened to me, but they're really just there for the concert, for the music. Other people don't really understand the music, but they like to hear my story. And that's why I sort of combine the two elements of that. But after it's all done, the main reaction I get a lot is, wow, I can't believe that happened to you so young, and it's such a strange thing to happen to you, and it's just amazing to see that you're doing all right. So it's always a very, very positive response from people, and it's nice to know that they're happy for me that I'm doing so well, and then I get to talk to them and encourage them as well. So it's a really nice interaction to have.
Okay. Is there any message that you want to give to the patients today, or all that are listening to us today?
Just hang in there. It's really hard at first. It really, really is tough. And I was there during the darkest times when I thought that I would never be all right. Especially at the age of 17, that's a very difficult thing to have to face. And things get better. Surround yourself with people, with family and friends who really, really care about you. That's the main thing you can do that will lift you up. And also connect with others who have the disease. That's a very important thing, because you do not want to feel like you're alone, because you're not. There's me and there's thousands of others who deal with this on a daily basis. And it's important to reach out to them and be in touch with them so that you can be encouraged and know that your life is not over. You will be all right at the end.
Good. Thank you so much.
Thank you
for being with us here, and thank you for joining us today.